So for the arthrokinematics of the knee, we're going to start off with open chain because that's a little bit easier. So that means the tibia is going to be free moving. So if I was to extend my leg out, that would mean that it would be an anterior roll and glide of that tibia, because if we look at the tibia, we have two large concavities. So with extension, we're going to get anterior roll with a anterior glide moving in that direction. Then if we do the opposite, we are going to get the posterior roll with a posterior glide. Then if we add in the screw home mechanism, the screw home mechanism is when you go into full extension, your toes point outward a little bit. So some sources say 15, some say 30 terminal knee extension. Your toes are going to start pointing out, so that'll be a lateral rotation of the tibia. So with extension, we are going to get starting off a anterior roll with an anterior glide, but then eventually when we get to the very last bit of the extension, we are going to get a lateral glide or a lateral rotation. And then as we come out of that full extension, we are going to get a little bit of a medial roll at that tibia. So that's the arthrokinematics with an open chain. Now with a closed chain, say if I was going to do a squat, or if I was going to be walking or something like that, which is going to be most of our movements, we are going to instead look at the femur. So the femur, you can see it has two large convexities. So if I do an extension of the knee joint, we are going to get an anterior roll with a posterior glide. And then if I do flexion, we are going to have a posterior roll with an anterior glide moving forward. So now we bring in the screw home mechanism once again, and it's going to be the opposite of when we were looking at the tibia, because now our reference point is the femur in this closed chain. So when I go into extension, the tibia is going to be going laterally, but since our reference point is the femur, we're going to actually be doing a medial rotation. Then coming out of that terminal knee extension, we are going to get a medial rotation at the tibia, and we are going to get a lateral rotation of the femur. So hopefully that helps.